Before the COVID-19 pandemic, things were less hectic for sure. We would have set days where we would see particular groups of patients. Some days being Children's Day, other days where we see chronic illness patients, and other days where we may see the general population with general concerns. Though we still try to maintain these days to some regard, we have become less stringent, so to speak, because we are prioritizing those patients who actually exhibit respiratory symptoms. Since then, we've had to change the structure of the facility. So one of the things we have done since the pandemic is we have now adopted an open door policy. And by this we mean that we keep the doors, the entrance, the examination rooms, the nurse's room, the doors leading to the passageway leading to the patient's bathroom, any door that the patient and other individuals could touch, we keep them open to avoid touching to these surfaces. And that would mean that less risk of transmission if there should be anybody who actually has COVID-19. Another thing that we have done is to turn off the AC in the facility. And this is in keeping with some comments that the virus doesn't actually live in certain higher temperatures. Another thing that we have also done is before the patients actually enter the facility in the mornings, we have a member of staff, mostly the nurse and the doctor, who would address the patients. And we try to separate patients in terms of those who may exhibit any likely COVID symptoms, and they would be sent to a different section of the facility. And those who have other things to do, we also separate them. So we try to minimize having a large crowd. And in recent times, like in the last week, where we've had to cut down on numbers as well, initially with the guidelines of the Prime Minister, no more than 20, and now we're down to no more than 10 in the facility. When a person exhibits symptoms which are generally viral symptoms which are common to many other viral illnesses, for example dengue, which we were just recently having a large number of cases as well, the symptoms are flu-like symptoms, and so it doesn't mean that because you exhibit the symptoms you definitely have COVID. We work using the case definition here in identifying those people who could potentially we deem are at high risk for having COVID. And then once it fits the case definition, then we have protocols in place where we call the ministry, we inform them, and there are measures taken to have transportation to collect these individuals to the appropriate isolation facility where they will do their testing and continue their care and follow up. There have been some cases, I won't say it's broad or it's a wide number of patients, but there have been some cases of patients not being forthcoming, and I think it's having to do with fear. The fear of stigma in their community, the fear of actually being sent away to be locked up, because I think some people have a wrong conception of what quarantine might actually entail, and so they have not been forthcoming. But you find that by probing and asking further questions, reassuring the patient throughout the interview, you find that they recognize it's not anything that they have to hide or become fearful about. So to reduce the fear that people actually exhibit, I would tell them firstly, what the ministry has implemented is a system so that they can follow up on what is happening with patients. So whether it's a case of quarantine where you're going to be quarantined at home, or you will actually be quarantined in a facility, there are different things that are done where you have temperature checks daily. If you're at home, you may get a call from a ministry personnel to inquire about your symptoms, to inquire if you're febrile, if you're having any fever on that day, and things of that nature. So it's really a monitoring system to ensure that if you should actually develop any worsening symptoms, then it can be addressed as soon as those symptoms develop. General precautionary measures. If the symptoms are mild, just like the regular flu, then things like your hydration, taking your vitamins, getting rest, taking your paracetamol or acetaminophen for any pain or fever. And as mentioned before, if symptoms do progress, then the ministry has also made available numbers for the hotline that you can actually call so that you can speak to the appropriate representatives who can then direct you in terms of what is the next step. From the perspective of a healthcare worker, since things have definitely changed, it has become more stressful. And so in order to balance or offset this stress, things that I have now appreciated much more include exercising. I take hill sprints in my yard at home. Another thing that I've also done is watching my favorite comedies, TV series, movies, and just in general, spending time with my family at home after a long day of work has been very pleasurable for me. And in doing so, I find that the stress of the work day that was before me is actually less, much less. And then when I wake up in the morning, then I'm ready to face the day that is ahead of me. Other things include, while being at work, because we have good staff relations where I work, so at the end of seeing patients, we may all sit and we may have general talks, not necessarily about the work day or the patients or the patient load, but if it's a bad day and we've had a rowdy crowd, then just to blow some steam to get that off of our chest. And at the end of it, we just talk about general things, things that may be happening in each other's lives. And we find by doing so, it makes the work that was less hectic. And even when you look at other individuals worldwide, you see the recommendations of things like exercise, your diet. It's important that we maintain a good nutrition, and sometimes as healthcare workers, because we're so pressed with the work that we do, we may not have time to eat properly or take a proper lunch break. But it's important to have good nutrition, good diet, balanced meals. And if it means that it's difficult to get food while at work, I would encourage that individuals pack their lunches to take with them. If it's even something small, so that in the slightest break that you get, we have a chance to put something in the stomach. The other thing that I would actually say too is rest. Rest is very important, and just like with dealing with any viral infection or any illnesses on a whole, rest is very important in helping the body to recover and to recuperate. And getting sufficient hours of sleep is crucial at a time like this to help us to be able to have the stamina to deal with what is actually happening at work on a daily basis. So exercise, diet, rest are important things from my perspective, but also just general things that you find pleasurable. If it's listening to music, watching a movie, if it's reading a novel, if it's calling your relative who is far away, to check in on them, to get a good laugh from a good friend. Things like those are important. And people are also using apps where they can connect with their friends all over the world, having video conferencing, and just general things that they would do if they were at a happy hour, for instance. They are utilizing those things in these apps as a means and measure of relieving stress and to relax. And I think as healthcare workers, we also need to utilize some of those things too. In terms of protecting my family, what I have done, just as I would have been doing at work, I educate everyone at home in terms of simple measures like hand washing. Actually, my 2-year-old daughter, if you should actually speak to her right now and ask her to show you how she washes her hand, the hand washing technique, which is standard, not just to rub the hands all over, having to do with between the digits, on the dorsum or the top of the hand, in the palm, rubbing the pads, rubbing the fingernails in the palms, things like those. Measures like taking off the shoes when you get to the doorway, leaving the shoes there. What I do when I get home, I take off my shoe and I actually spray with my antibacterial, antiviral spray, and I leave it there and I don't touch it until I'm leaving in the following morning. Other things that I have done to, protect my family include having general sanitizing products at home. So we have our sprays, we have our hand sanitizers, and of course soap, because that is needed for hand washing. And it's just general talks about how to keep clean, how to keep the surfaces clean, cleaning the countertops. We also have to clean the floors, because at home we have young children who are under the age of 3. And so just to keep a clean environment. And any surfaces that you have to touch, the pipes, the toilets, on a daily basis, all those things are cleaned, and we clean them with the appropriate sanitizing products, whether we use bleach or we're going to use soap and water, depending on what surface we're talking about. What motivates me to keep going is, from the good old days, medical school, and on the completion of medical school, and we had to take our oath. And with that, we know that we will be thrown in some situations where it may not be what we really want, but it's just what we were trained to do. We were trained to go out and look after the sick, and to the best of our ability, give them the optimal care at all times. And in a time like this, if all healthcare workers were supposed to stay home and shut in and lock in, then the sick and the vulnerable would just pass away, and it would look bad on our nation, it would look bad on our healthcare system. And so it's something that comes with the job. It's something that comes with the job, and most times, and for most healthcare workers, you get into this field because it's a love that you have for the job. And for me, it's a love that I have for my job that motivates me and keep me, and the faith that I have in God to know that He will protect me. And so that is just my daily mantra. Get up in the morning, thank God for life, and just go out and try to do the best that I can to make the nation better.